Welcome back to another episode of Board Bitesize. Today we are joined by our Chief Executive Jim Austin and our Chair Julie Holder. We've just finished June's board meeting and stepped outside to reflect on what has been discussed today, in line with our organisational strategy themes of people at the centre, working in partnership, healthy communities and focus on the future.
So hello everybody, it's Jim Austin here and doing the Bitesize little podcast that we do after boards. We had our public board today on Thursday the 5th of May and I'm joined as always by our chair Julie.
It's June, Jim, but you know, we're okay. You were on holiday in May, but I think that's a good start. It shows we're human. So hello everybody, it's Julie Holder here and I'm just going to start today by just having a bit of reflection on today's board. And I think for me, today's been all day, we've had a real focus on our strategic theme of people being at the centre. And although that cuts across all of the themes, it's really stood out for me. Our staff story began with the difference that has been made by the investment in a pharmacy technician clinical educator who was appointed in 2022 after a bid that was made actually at a board development session. And that has allowed that team to develop their own staff and skill mix. Sadly, we went on to talk about how difficult this is going to be in the current financial climate that we find ourselves in. And we talked a little bit about the direction of travel for apprenticeships more generally. And we're going to do some more work on this when the guidance is known as to how we might be able to use the same sort of approach in other teams. But it does look as though it's going to be a little bit difficult going forward. Our story recognised that three particular people, that was Connor Slingsby, Lauren Batty and Claire Brown. And all throughout today, our reports have been peppered with a number of recognitions. I said goodbye, as so did you, to Michelle Bateman, and we welcomed Abby Traynor. We actually gave admin colleagues, we talked about their contribution that they make to DCHS and more widely to the NHS. You and I had actually visited the Dales Wound Care team and we had a really good session over there and on the insight visit. I referred to our colleagues on the Portland ward rehabilitation ward at Chesterfield Royal Hospital. I went for a visit there and that was really good to speak to them. In your report, we talked about Sienna Murphy, Robert Holhouse, Kerry Hawkins for their research work, and Amanda Kerry, Vicky Barsby, Paul and Lauren Gascoigne for their contributions at the Day of Learning in Manchester. I just also wanted to acknowledge all of the work that's been going on and specifically Ian Lawrence, Dr. Penny Blackwell and Nikki Doherty from the ICB for all the work that has been going on around Team Up and developing neighbourhood health and care models. And finally, we said a couple of times, but just to say again, we welcome our 28 new colleagues from Chesterfield Royal who have joined our speech and language services. So a lot of recognition today, and I think it's important to actually acknowledge that.
Thanks, Julie. And so to bring on to the theme of healthy communities, we spent quite a lot of time at the board discussing various elements of Community Transformation Programme, which is a big piece of work that we're doing across all the providers and the local authorities in Derby and Derbyshire. Really just about to kick that work off now. A lot of analytical work taking place over the last 2 years. We talked about how that would impact us, impact citizens in particular. It does link to something I'll come back to a little bit around neighbourhood working as well. But I think one of the, reflecting on, it was a 2-hour meeting, reflecting on one of the conversations we had was just around the climate that we're in at the moment and the pressure that will come both on cost, but on quality, on all the targets that will be required to meet. And while NHS England are reducing the number of targets that they will be examining, we reaffirmed as a board that some of those that are likely to be not featuring in the future, particularly around addressing inequalities, addressing parts of need within our communities, would be still very much at the centre of the work that we would do, because we understand as a board that by addressing those that are most disadvantaged in society, to make sure they get the right care at the right time and in the right place has a massive knock-on positive impact, not only to those individuals, but also to the wider system. And so that community element and that healthy community part was actually quite a big part of the conversation. And I just thought I'd reflect on that. Back to you.
Yeah, that developing neighbourhoods came up all day, doesn't it? And it's going to be, work is going to be a priority nationally in the soon-to-be published 10-year plan. Which we heard all about at the regional meeting that you and I attended on Tuesday. And your presentation actually at that meeting demonstrated just how much we've already done in Derbyshire. Sometimes I think we forget just how much we have done, but how much our own staff already work in partnership, a range of partners on a day-to-day basis. And we talked, I'm going to go back to that Dale's wound care service. It's certainly stuck in my mind over the last couple of weeks, where we talked about potential opportunities of working with the voluntary sector colleagues there in order to create a community space at New Home, where we were actually talking to the team. I was also really pleased to chair the Provider Collaborative Leadership Board last month, where despite the pressures of 25-26 delivery, we're still committed to working together to improve services whilst delivering better value through transformation of services. And we can only do that in partnership with a wide range, but particularly with our provider colleagues.
Thanks, Julie. And then just finally to focus on the future a bit, I think there was a lot of discussion at board and after the board meeting around the changes that we are all going to have to undertake. And you and I, Julie, did a team brief, which is available to all colleagues, actually, featuring around the changes we're going to need to go through. We're very mindful of the changes announced around the Integrated Care Board and the people there, but we ourselves are going to have to transform and change the way the work that we're doing. So there was a bit of a focus on that. And we've talked about it a couple of times, the neighbourhood health model, which will underpin the delivery, we think, through the 10-year plan that's going to be published in July. We are already organised and arranged around neighbourhoods, so that's really encouraging. I think we will get into that detail with teams as we try and design not only the community transformation programme, but that neighbourhood way of working over the next few months. And then finally, I just thought I'd reflect on, we had a development session around Mental Health Act, a bit more work on that, and really good to see the details around that, but also on safeguarding. And we spent an hour as a board with the safeguarding team, and they took us through the challenges and opportunities and risks that there are, not only within our services that we run, but actually how we connect in with the broader footprint across education, across social care, the police and everywhere else. So some vital work there, and I should really just thank Elaine Summers, Sarah Tomlinson and Miranda, who came along to talk to us about those elements for the board and just make sure that we were well sighted on the risks and opportunities there. So I think, Julie, that was my summary of the day. It's been a long day. We've had a lot of complicated conversations. Is there anything you'd like to round off with?
No, I just a really big thank you. Thank you to the people who actually took part in today's discussion. The safeguarding discussion was particularly helpful, I think. I really enjoyed that, the whole day. Always feel a little bit tired, but energised at the same time. So just a massive thank you to everybody.
That's all for today's episode. Board Bitesize will be back after the next public board meeting.